So technology in IVF has exploded in the last couple of years. The first one is the introduction of time-lapse technology. So historically, what happened was you would have your egg collection, they would go into an incubator, we'd take them out of the incubator, mix the sperm, we'd check them the next morning, they'd go back in the incubator, you might check them on day 2, you might check them on day 3, you might check them on day 5, and again on day 6. So all you get is little snapshots, and you're having to remove them from their environment to check them. Bearing in mind, embryos have to be cultured in high CO2 environments, not 20% oxygen, which is what the normal atmospheric conditions are. So you're disrupting their environment by doing that. With time lapse, what it allowed to do was to basically put a camera into the incubator, and you can monitor all of those embryos every 10 minutes without disturbing that environment. And what that allowed us also to do is see their whole development throughout their entire process. And that allowed us to deselect embryos. So, for an example, on the old system, if you checked an embryo and it was fertilized, and then a 2-cell, and then an 8-cell, and then a blastocyst that you think it was good. With the time lapse, you might see the fertilization, then that divide straight into 3 cells, and then, which is not a good development point. You might see it not be as good on day 3, but it still makes a good quality blastocyst. And it's allowing you to deselect those embryos and look at what's called morphokinetics to help us select the best embryos for patients and give them the highest chance of pregnancy. Now, when you compare the outcomes, so if you look at clinical pregnancy rate per transfer, whether it's a time-lapse embryo or a conventional incubator embryo, the pregnancy rates are identical. But what the laboratory key performance indicators have shown, actually in the time-lapse incubator, you get a lot more blastocysts formed, significantly improved blastocyst formation rate. And what that does is allows us to freeze more blastocysts. So say you get 4 blastocysts frozen in a time-lapse and 3 in a conventional incubator, you've then got up to 4 attempts of frozen embryo transfers of getting pregnant versus 3 with a conventional. So you have a higher cumulative live birth rate using time-lapse technology. And, everything is all the success rates and the way things are set up is to measure pregnancy and live birth rate per transfer. That's all well and good, but, if you're having 1 egg collection and that's costing you the most money, that's the biggest chunk of your pot of cash that you have for your fertility treatment, you want to have as much sort of bang for your buck as you like, and that gets you the most embryos and more chances of achieving a pregnancy. And over the last 12 to 18 months, because we're accumulating all of this time-lapse data and these morphokinetic timestamps, you can pull hundreds of thousands of embryos which have been transferred. You can do it between clinics, you can do it internationally, you can do it from all different countries. You can pull all of the data together, all of the timestamps. You can look at which ones got patients pregnant, which ones didn't get patients pregnant, and you can build artificial intelligence algorithms based on known implantation data. So actually, when an embryologist comes to look at the embryo selection for a patient at transfer, they may be having a bad day. They may not have had their coffee in the morning, and they may change their mind. There's more subjectivity there. The beauty of AI is it doesn't have that subjectivity. It's more consistent. It will make the same decision time and time and time again. So when you apply this AI algorithm, it will look at things, so all the movements of the egg, all of the divisions, the amount of fragmentations, and it will tell you which embryo to transfer. And the repeatability and the prediction of those AI models is pretty good. And the fact that how consistent it is also pretty good. So it's an exciting time for technology, particularly in IVF and time-lapse.